Waiting for the connection. Hello, Dr. Todd. How are you? We did it.
Well, can you hear me?
I can hear you perfectly. How are you
Okay,
today?
awesome. I'm pretty
Good.
good. I'm pretty good today. How are you?
I'm well, thank you. Thank you
Awesome.
for joining us here. Dr. Darwana Ratleff Todd is a board certified OBGYN. She's an alloy prescribing physician. She is a native of New Orleans, Louisiana. But Dr. Todd, you're currently practicing in the Southwest. Is that right?
Yeah,
Okay.
yeah, I'm more on the West Coast,
Yep.
Nevada area. So
Yep.
yeah.
Yep. She's been a practicing physician for 20 plus years, is also a military veteran, and has been an ardent supporter for perimenopause and menopause hormonal treatments throughout her entire career. Thank you again for being here with us today. Today, we're focusing in on brain health in menopause. And
Yes.
I wonder if you could, I was thinking to, when we touched base prepping for this conversation, and you kind of just beautifully and fluidly laid out for me, kind of cognitive function slash brain health for women premenopausal through menopause. And I wonder if you could just kind of lay that out for us here and now, just to kind of set the stage for the rest of the conversation.
Yeah, absolutely. Once again, I'm an allied prescriber, so a lot of what I'm going to talk about has a lot to do with how our hormones influence our brain health and how they impact our brain health. So that's super important as we are entering into menopause. And prior to, so just kind of to give you a little bit of subjective as to how you go from premenopause to menopause, and what changes happen in the brain that might influence these things that we call brain fog, or just some mild cognitive impairment. And, of course, how do we try the best we can to prevent dementia? I'd like to say, I'm just going to put a disclaimer, I'm not a neurologist, so I'm going to try to get this right, but again, I'm going to approach it toward the hormone.
Thank you. Perfect. That's
So
perfect.
in the world, overall, we have a 20% chance as women of getting dementia. So, however, when we approach menopause, our chances of getting dementia goes up to 40 to 60%, which is significant, a lot, significantly higher than what we are before. And the reason being, and what's thought, is that our decline in our estrogen levels as we are aging is one of the culprits as to why this is so. So traditionally, men have more of a chance of becoming demented until we women are in menopause, and then we beat them.
Right.
So we're trying to figure out, how can we, turn that clock back so that we aren't such at risk. And so what we found in a lot of the studies that have been reported was that estrogen has a lot to do with it. When we are premenopause, we have higher levels of estrogen along with higher levels of receptors for those estrogen in our brain. And so that actually helps us a lot. It stimulates the brains, it keeps the neurons firing, it supports the growth of new cells, as well as help existing cells form new connections. And the brain is kind of a mishmash of cells that actually fire off to each other to tell what parts of the brain to do what processes. And so when those firing levels are not up to par, then that's when we start to have some cognitive decline. At the cellular level, estrogen will push your brain cells into burning more glucose. So that's another way, because it causes in the mitochondria to increase the ATP, which gives our cells energy.
Okay.
And so consequently, we burn more energy when we have more estrogen. And so what we're talking about when we talk about estrogen is 17 beta estradiol. Okay, I'll tell you a little bit of differences about what that is.
Please.
We have 17 beta estradiol when we are young women, and that's the predominant estrogen that we make.
Okay.
When we are in menopause, we have more estrone.
Okay.
And so our 17 beta estradiol falls, our estrone levels are higher. And so with the fall of the 17 beta, fall of receptors, which means we have higher estrone receptors. And the studies were done with conjugated equine estrogens. And so they have more estrone in those. So of course, now you got to study, a lot of the studies that were done, not saying that they're invalid or anything, but they were done with hormones that we're not getting the benefit from decreasing dementia, so to speak.
Okay.
And so consequently, this becomes an issue, because if we're not having that 17 beta, how can we maximize getting that? And why is it important that we get that? So what they say is that estrogen replacement therapy helps prevent dementia by keeping your neurons, again, firing, by keeping them energetic. What they saw was, though, the longer you take it, there was a little bit of an inverse relationship. But I think it's because of the receptors. Once again, we have more estrone and those receptors have downregulated. So we need to keep those up there. And that's what happens in the menopause transition and premenopause and the menopause transition and leading into menopause. So what almost all of the studies say is that within the first 5 years of you entering menopause is the best time to take the hormones, if you're going to do so, if you're able to do so, because I realize there are other conditions that people can't. But in that first 5 years, 17 beta estradiol, which is what we do have at Alloy, plant-based 17 beta estradiol formulations, that's key to preventing dementia going forward.
So Dr. Todd, can I pause you just for 1 second? So to understand, our estrogen is declining, our estrogen receptors are declining, something else is rising, and we need a certain type of estrogen, ideally, in order to sort of keep things upregulated and receptors. Okay, got it. Yes. And that's, okay, I'm sorry, go ahead.
Absolutely, that's exactly what I'm saying. So I'm glad you rearticulated it for me, because sometimes I might just ramble off, but this is good.
No, it's just science speak. Science speak is different from layperson speak, and I want to make sure that I'm understanding it correctly. Okay, I got you. I follow.
So another thing is an increased risk of dementia is seen with younger ages with patients who get oophorectomies, meaning their ovaries are removed for whatever those reasons are, and that is even one ovary. They still see an increase. And again, it speaks to the fact that they're not putting out as much of that 17 beta estradiol that they were before. So let's just talk about, exactly how does it do this? Okay, so it improves verbal memory. It decreases forgetfulness, which a lot of us start to have as we are perimenopausal. Yeah. It decreases errors in tasks. So, we're doing things and we're like, it decreases that. It protects against, everybody's heard this, beta amyloid induced damage to the brain. A lot of times when they talk about dementia, they talk about the amount of beta amyloid that you have in your brain. And that is, when you have a lot of it, that is what causes the Alzheimer's dementia. They have seen these on MRIs. So with estrogen helps decrease the beta amyloid types of damages that can affect your brain functioning and your processing. There's also something called a TAU, T-A-U, not T-A-R, but T-A-U protein. Under normal conditions, these are like proteins, they're like macrotubules, and they allow for a lot of the passage of blood flow to the brain, okay? And so with blood, of course, there's nutrients and things like that, and this also allows, they're like, I guess, highways to allow the waste to go out of the brain. So when you don't have those estrogen, they say an abnormal amount of these filaments fill up and they clump together and they cause what they call taut tangles. And with these taut tangles, obviously, if you have highways that are like this and they're all tangled up, how do you get the waste out and the nutrients in? So that impacts our functioning as well. And estrogen helps prevent that. It also talks about, where estrogen focuses and increases the blood flow. The hippocampus and the superior temporal gyruses, those are responsible for a lot of our motor skills. It activates the superior cortex, the inferior parietal cortexes. So it helps with verbal memory.
It's amazing.
Yes,
The
it's
list
so many
is
different things.
long.
Promotes the growth and survival of cholinergic neurons, and it does this by increasing the density of those neurons in the
And
hippocampus. So,
what are those? You made that sound like that's particularly important, but
well, the cholinergic neurons in the hippocampus, it actually, like, again, goes with the verbal
okay,
memory, the memory, the verbal stimulation, that type of thing. So
okay,
that helps with the process of these things.
okay,
And short and long-term memory, it depends on blood flow to those areas for you to keep those active, that short and long-term memory. And it also says it decreases degenerating neurons. So there are neurons called ApoE. They're those neurons in the brain. Well,
okay,
ApoE4 is kind of one of the things that is in the presence of degenerating neurons. Well, estrogen helps with preventing those things. So we also get that benefit from it as well. And then they say younger, of course, postmenopausal women have higher density of those muscarinic receptors. So that's why they have less memory impairment.
So, Dr. Todd, I want to pause you one more time and ask, as I'm listening to you, I'm thinking two things. I'm thinking estrogen is very powerful and sort of has its lane. And then there's the other hormones that we are familiar with, progesterone and testosterone, which we are not able, you can speak about why we're not able to share testosterone with the masses, but I'm wondering where those other two particular hormones play into brain health. And
Absolutely.
I'll let you, before I go on, I'll let you answer that one.
Okay, so I'm going to say this because, and I'm going to say it with just a little bit of guardedness.
Sure.
Because there was only one progesterone that's really been studied, and that's medroxyprogesterone. That is a synthetic progestin. They don't have a lot of literature on micronized progesterone, and that's the progesterone that we produce from our ovaries.
Right.
So since there's not a lot of data, I'm going to speak on this other one. But what they say is, and it's going to make sense because we women who have uteruses, we have to take progesterone.
Mm-hmm.
However, unfortunately, progesterone can counteract the effect of estrogen. It does that also in the uterus to keep our uteruses from getting hyperplasia or malignancy. So it makes sense that some of the benefit that you're getting from the estradiol may be a little bit less when you're taking progesterone with it. Progesterone doesn't have a huge impact on the brain health itself like the estrogen does. However, what they say though is when you are getting the estradiol for your vasomotor symptoms of menopause and the sleep issues of menopause, because those also impact brain health, if you're getting relief from those, even if you're getting progesterone with it, you're still helping to prevent those degenerative changes because you're getting the necessary amount of hormone to the brain, so that you can have the function that you need. Because vasomotor symptoms it will severely impact your life in terms of your brain health. And if you've experienced
them, yes, you know that. Sorry, I didn't mean to interrupt you. I just got so excited to hear that. It's honestly, the vasomotor symptoms, the night sweats, hot flashes are so impactful on your ability to get through a moment, an hour, a day, focus on tasks, focus on anything, be in a decent mood. So all of that, yes.
Yeah, and if you're not sleeping, you're not allowing your brain to rest or to get blood flow to it. So again, if you are taking care of those symptoms, which progesterone, micronized progesterone, let's make sure that I, clear that up.
Sure.
That helps with sleep. So while it doesn't directly impact what's going on in the brain, there's an indirect way of helping it.
Yes. Thank you. That's so helpful. And testosterone, as I
So
know people have asked about that sort of in the background, that testosterone, and correct me, is sort of off-labeled or understood to be helpful with symptoms, cognitive symptoms of decline or brain fog or focus, but is not accessible to everybody.
correct.
Could you talk about all that a bit?
Yes. So, unfortunately, testosterone is a controlled substance. And so, and it's off label use for women. Although we do make testosterone from our ovaries
Right.
and also our adrenal glands. So, we make it, we have it, it's utilized in other parts of our bodies, but we have a very difficult time prescribing it because of the fact that it's a controlled substance. And so, when you are online, what most of the states make you do is you have to see a person in person to prescribe controlled
Right.
substances at least once a year. So if you're not able to do that, then the ability to prescribe this medication, which is pretty good and critical, and I'll talk a little bit about that, is impacted, obviously. So because online we can't see people in our person
Right.
face to face. So that's where that comes from, and that's why we can't prescribe it online. But
Okay.
they say progesterone, which again is produced by the ovaries, it strengthens the blood vessels and the nerves, and also helps create mental sharpness and clarity, as well as overall energy levels in the brain. So it also helps with the arteries. Of course, if you have strong arteries, those things just can't break and they can't leak. And because the other thing you worry about too is not only Alzheimer's dementia, but you also have what they call vascular dementia, and that's what they call stroke. So if you
Okay.
have things that are brain bleeds, uh,
Right.
that can cause you to have a stroke. Well, testosterone helps to strengthen those arteries, to improve the blood supply, which also protects against the loss of memory. And of course, memory is key because everything you do kind of relies on your memory as you're aging. I mean, eating food,
Yes. The simplest
walking.
of tasks. Yeah.
Yes, your ADAs, they call it activities of daily living. That depends on your memory. And so if your memory is not strong because you don't have the right amount of hormones there, then that's how dementia happens. Now they do say, when we are in perimenopause and we say, oh, I can't remember this. Oh, I went to do
Sure.
that. What am I doing again? That is called mild cognitive impairment. And so what they say is that's not truly dementia. That's just something that, as we are aging and we're busy and we're doing things, that those mild cognitive impairment things can happen because we just,
Yeah.
the synapses are going so fast that we simply can't always keep up with everything. But what
Yeah.
they tell you to do is do different there are different types of testings that you could do. One is called the MMSE. It's called the mini mental state exam. That actually tells you where you are in the process, and I think you probably can get those online. They also recommend there's a one that's in Montreal. That's a test that you can get online, and it's called I can't remember the name of it, but it's from Montreal, Canada, and I think it's the MCO or MOCAN, and it's a test that you can see to detect what your cognitive function looks like.
So Dr. Todd, just to sort of close the primary loop on hormones, um, for the many women who've been kind of shortchanged, to say the least, about or as to hormone therapy, they were sort of the immediate people impacted after the WHI study and so on. There are many women who are sort of later to the MHT conversation, and later in their years wanting to now consider taking MHT. Can you talk about sort of, is it ever too late? I understand that it's not, but there is this sort of sweet spot in terms of cognitive health and brain function. So can you tell us
Absolutely.
about that?
Yes. And the Menopause Society, formerly known as NAMS, also touches on that. And, here's the take. Once you are 65 years old, to take menopausal hormone therapy for brain health is no longer recommended because you're not, again, remember those receptors are not quite there to get what you need in order to help with things that I previously mentioned. So consequently, it's not as helpful. However, if you are, say, 65 and you're still flashing and you're not sleeping
Right.
and you're still having
Right.
night sweats, and you have no other comorbidities such as cardiovascular disease, such as have a history of having a stroke or a blood clot or, breast cancer or something like that, and you feel like, what, I do need it,
Right.
you may get some benefit from it because obviously you are symptomatic and
Mm-hmm.
symptoms mean everything. I can't, I know a lot of people like to see the labs. Hey, show me the paper, show me the paper. I'm like, you know what? The paper is not you. You are a person. And so clinically, how can I help you best? And so while there's no arbitrary age for you to discontinue hormone therapy at all, there's no age.
Mm-hmm.
They have now just debunked that. The International Menopause Society has debunked that. Okay. There's no age. However, to start them later in life will not help you with prevention of dementia. At that
Okay.
point, those cells, those proteins are there, that amyloid is there, the receptors are not there enough. So the sweet spot they say is within 5 minutes. Now remember, what does that say within 5 years? Well, okay, say you went through menopause at 55. You
Right.
got until
Yes.
age
So glad
60.
you're saying this. Yes, yes, yes. You can certainly be within your early 60s to get started and still reap all the benefits. And I have to just say, and you highlighted this so well, but if you are symptomatic, and some women are so into their 70s, addressing those symptoms, and we understand MHT to be the best way to address those symptoms, the sort of first line of defense
Yeah.
against those symptoms, several other things, it's worth at least having a conversation with a menopause specialist. Wouldn't you agree?
It is. It is because, we will guide you
Right.
properly. And
Mm-hmm.
sometimes, our patients who are past that age of concern, we will we will hear them, listen to what their symptoms are, and how can we best serve you if you do not have a medical condition of which we can't. And we can talk about those things too, because we have other, treatment options out there that will help, not so much with the brain health and things that we're talking about, but in terms of your estradiol and things like that, we can start super low. There's so many different ways to nuance
Right.
hormone
Yes.
therapy. And
I
here
love that
at
word
Alloy,
nuance. Yes.
even though we're an online platform, we still can help you because you know how many times I have to adjust certain patients
Right.
because I sometimes have to go up. Do we get it right always the first time? No, but does your primary care doctor get your blood pressure medication right the first time?
Right.
No,
Right.
not always. Sometimes they get it right, and it's the same thing where it relates to hormone therapy.
Yeah.
Sometimes we get it right off the bat. Boop.
Yeah.
But there are other
Yeah.
times that we have to adjust up, down.
Yeah. I appreciate that. And actually recently went through it and have often gone back to my prescribing physician to get little tweaks where I saw fit, which leads me to sort of the silo I call the anyways, meaning the things that we should be concerned about anyway, the things that impact brain health, cognitive function anyway. So you did mention sleep. That was one of them.
Hmm.
Certainly being nuanced in your MHT care is another. What you needed a year ago may not be the dose that you need today.
Correct.
Um, but also, when we had a chance to touch base, you talked about hypothyroidism, uncontrolled diabetes, family history of dementia, and Alzheimer's. Cholesterol. So could you unpack those a bit for us and just kind of highlight the things that we should be thinking about, following up on, being aware of as best as possible anyway?
Yes. So again, you touched on almost everything. Keeping your thyroid normal, keeping your hypertension at bay, making sure that, those levels, it's well controlled. Your cholesterol is well controlled. And a lot of people will look at the ratio, and that's fine, but you want to have that control. Sleep apnea. A lot of people, have sleep apnea now these days, trying to decrease, those changes. If you're a smoker, of course, stop smoking. The other thing is they mentioned too was that vitamin B12 or vitamin B complex is very helpful in helping prevent or helping you with those memory related changes, because for whatever reason, it gives you mental focus. So taking B12 is really helpful. And I can't stress enough is getting enough rest, because and sleep apnea again will affect your rest.
Yeah.
And of course we know with diabetes there are vascular related changes that happen with diabetes that of course if they're happening externally, they're happening in the brain too. So we have to remember that exercise, that's another one. A lot of people say to me, because I get up super early, I have to be to work at 6:20 in the morning. So I get up at like 3:45, 4 o'clock. And, oh my God, how could you do such a thing? And I'm like, but I have to, because I can't focus. I could tell the difference in my focus when I don't and when I do, especially particularly when I, didn't get enough rest the night before and all these things. So at the end of the day, there are so many things that impact us, our healthy diet, our sleep, our exercising, increasing the blood flow to all the areas of our bodies, and of course our hormones.
Right. Thank you. Now, finally, because I always sort of land on stress as in many ways, arguably sort of the biggest hurdle to get over regarding just about anything. So if you would just speak to that for a bit as well.
I agree.
She says with a sigh.
Stress is so hard to manage because there's so many different elements of it. It's if you are bothered by something and it's stressing you out, that something won't go away until you're able to process that. And of course, if now you are having some issues with processing, right, then that stress probably gets magnified, And so consequently, you then feel like, okay, I can't remember anything, but it's because of whatever that stressor is. I like meditation. I like long walks. I like listening to some song, because sometimes that will break you away from whatever that issue is and help you with dealing with the stress. But keeping your stress level low as best you can, not every, every situation is different, is so helpful in preventing cognitive changes. Because stress is a big one. All those hormones start just going all over the place, and there's no rhyme or reason. Your cortisol levels are all over. It's just the things that you have going for you can't really go for you or take care of you because of all these other rushes of things that's happening.
Right.
So easier said than done to decrease stress,
but something to be aware of, certainly, I think, and it gets overlooked so much. I just wanted to comment here, looking back at some of what people said, and I know this doesn't speak to us directly, but I do feel like this testosterone thing is going to bust wide open for all of us pretty soon. And someone did say, since I started taking compounded testosterone cream, my mood immediately improved and I felt more rested after a night's sleep. The effects were immediate in contrast. I can't read the rest of what she wrote, but I thought that was just interesting. And then someone asked, can you suggest types of estrogen and progesterone?
So, again, we typically will use plant-based 17 beta estradiol
Hmm.
to treat because, it's the best. Now, most of the formulations out there now are considered made with the 17 beta estradiol. So that chemical
Okay.
formulation is most of the formulations that you can get prescribed. Again, as you age older, will we have to nuance those? Yes, if
Hmm.
if you feel really, need it for symptoms. In terms of the progesterone, micronized progesterone is key. Um, because again, that is a chemical formulation of a medication that mimics what we make in our bodies.
Right.
So we're only giving our bodies back what we already make, what we already were making, I should say, when we were
Hmm.
younger women,
Hmm.
and again, there's three types of estrogen, and so I'll comment on the other one, the estriol. Estriol is found in for us who had babies, in our placenta at high levels. So we have had that. They have to be at very high levels, but that's where you get that one from. You have it lower levels otherwise, but those are the ones that help with some of our skin issues.
Hmm.
Hence, your skin is beautiful in pregnancy and you're glowing. Well, yeah, there's that glow. So we have we have that as well. So
Right.
it's, but the main one is 17 beta estradiol. That is your main estrogen that is going to be the best in terms of if you're going to start menopausal hormone therapy within that 5 years, or that perimenopause, that menopause transition at 5 years, even after your period. That is the one that, that we would typically prescribe for you. And that is the one that we've made in the past. You know, sometimes a lot of people will talk about the compounded versions.
Hmm.
Um, they're not FDA approved.
Hmm.
So, and then we don't, or there's no way to figure out what is formulated in those compounds. Like they are not very well regulated. So they can
Right.
kind of put them, they can put the 17 beta in there, but what else are they putting in there? That's, those things are not regulated, and even how much. So it's really difficult to say to use those. I don't recommend those unless you have, a sensitivity or a reaction to one of the ones that's prescribed as a pharmaceutical. So that's kind of where I stand with that. We have patches, we have gels, we have sprays, we have pills, um, every kind of form
Every
of
kind,
the
and
medication
to your point about being nuanced, sometimes trying a different
can
formulation
help.
is can help very much. And so don't be dissuaded if that is suggested to you.
And one
Yeah.
more thing about that, I read in my, preparing for this.
Hmm.
They say transdermals are better in term because it gets right into the bloodstream. So you don't have that first pass of the liver to cause any type of induced clotting. So you're getting the 17 beta, and it just like anything else that's absorbed straight into the blood. That blood flow, when your brain is active, because it's thinking, can go right through it with the hormone in it.
Fascinating. That's so good
Yes.
to know.
So that's also
Okay.
a very good benefit for that.
Thank you, Dr. Todd. So, okay, just to close us up here, hormones, sleep, exercise, a vitamin B complex. What did I miss? Stress mitigation,
Yes, and taking care of any comorbidities that you may have.
taking care
Diabetes,
of
high
any,
blood
yes.
pressure, heart, any kind of comorbidities that keep you from having or from, being your best, living your best life. No smoking, all of those things.
Can I also add something with a question mark for your approval? Um, eating well, nutrition is so key all
Correct.
the time, and key impactfully so to all of those other things, right? To sleep
Correct.
even. Yes, so eating a lot of plants, a lot of fiber,
Yes.
lean protein,
Lean
hydration.
protein, plants, hydration. Hydration is key. I say that with emphasis because I don't hydrate enough. I'm always
I
dry
love your
mouth.
emphasis.
So it's like, well, I gotta do, I gotta practice what I preach, right?
I love your emphasis, Dr. Todd. It's so affirming. Dr. Todd, thank you so much for this time. Thank you
Absolutely.
to everybody who came. It was a wonderful conversation. It just kind of homed everything in and encapsulated all of the nuances, the critical stuff in a way that's palatable for all of us. For those of you out there who are not familiar with Alloy, I do just want to encourage you to head over, take a look at our website. I didn't mean to say this, by the way, but I feel so strongly that speaking to a menopause practitioner is that critical to us in this season of life. And that's all we got there, menopause specialists who know the science and can work with you closely, given your history, your symptoms, and so on. So you can find Dr. Todd there as well. And thank you again, a pleasure.
All right, thank you so much for inviting me in.
Thank you. We'll do it again. I'll be
Yes.
seeing you soon. We have a webinar
Okay.
coming up.
All right, take care.
Thank you so much.
Bye,
Bye,
Rachel.
everyone.